Started and we're recording.
Good afternoon, everyone. I am so excited to be hosting this panel, and I want to thank everybody that's joining us today. So welcome to our panel titled Aging at Home Supports. So my name is Nikki Sage. I'm a community outreach coordinator with Home Instead, and I am delighted and honored to be able to be your host for this panel. And before we really dive in to a lot of the content we're going to go over today, I would like to start with some housekeeping items for everyone. So everyone should be muted and camera should be off unless you are the presenter. And I'm going to introduce every presenter as we move through the fantastic guests that we have online with us today. During the session, if you do have any questions about the technology, please type them into the chat box at the bottom of your screen, and our team member, Kelsey, will be monitoring this. If you have any questions about our panelists, maybe during their presentation or afterward, please submit them as well through the chat box. Or you can even raise your hand and Kelsey will be able to unmute you so you can ask your question. We definitely encourage questions and we're hoping to really gather some information sharing. So each panelist today will have 10 minutes to provide an introduction about their services and kind of showcase what they offer the community in terms of aging at home supports. Questions will be answered once the presentations are complete, so please be patient. We will get to all of the questions. Please note this session is being recorded and it will be made available at a later date online. So if you missed something, don't worry, we're definitely going to come back to the recording and you can catch up. If you require any closed captionings, including French language options, please turn these on using the CC button found on your screen. I'd also like to start by acknowledging the Robinson-Huron Treaty of 1850. I further want to recognize that my organization is located on the traditional lands of the Anishinaabe and acknowledge that nearby Anishinaabe communities of the Dokis First Nation and the Timagami First Nation. I am presently located on the city of Greater Sudbury, and I acknowledge the traditional lands of the Wanapitei First Nation. As descendants of settlers, we extend our deepest respect to all Indigenous peoples. And before we dive into the presentation, I'm going to throw it back at Kelsey, my team member, who's going to start with a poll for you guys, an introduction poll. So take it away, Kelsey.
So pop up on your screen right there, you'll see 3 questions. We're asking your age, how you identify, and where you're located. So we'll give the group about maybe we'll say 30 to 60 seconds to complete the poll, and then I will share it with everybody, and Nikki can walk you through the stats.
Oh, sorry, Michelin, I didn't notice that. Michelin put in the chat, we're having technical issues for the closed captioning, so I apologize.
Okay, we're at 80%. We'll give it a couple more seconds and I'll share.
Wow, you guys are fast.
Mine isn't working. I can't get it to populate when I press it, unfortunately.
Not to worry, actually. The polls only go to the attendees. They don't actually reach us panelists. All right, so I'm going to end the poll right now and I'll share the results.
Okay, what is your age? Oh, this is very interesting. So we have 70 to 79 and 80 years and above. And how do you identify? Older adult 55 plus. Well, this is very interesting that we have a lot of older adults online with us today. Wow, thanks for doing this poll. This is really great. And I'm excited because you have a couple more polls later on towards the end of this session, correct, Kelsey?
Yes, I do.
Oh, I'm excited. Well, thank you for participating in that poll. It's always great to get an idea of who's online with us today. As we're providing some really, really great information. So I will start with our first panelist, which by coincidence is actually me, Nikki Sage. So I just want to give Kelsey a second. I believe she has my slides. If she doesn't mind putting those on the screen for me, I'd really appreciate it. Awesome. Thank you. I'm going to minimize some of my stuff on here. Oh, well, thank you all so much for joining us. I appreciate your time today. And I'm really excited to hear from a lot of the other panelists that are going to join us as well. Starting off, my name is Nikki Sage. My title is Community Outreach Coordinator with Home Instead. I always like to say an interesting fact about myself. I absolutely love animals. I have a teacup chihuahua named Minnie, who's 3.5 pounds. And in my spare time, I love to sing and songwrite. And in terms of Home Instead, I've been with the organization for over 6 years in the community outreach role. Next slide, please. All right, so I threw a quick agenda on here as well, just to kind of show you what I'm going to be talking about today in my presentation. I'm looking forward to any questions you guys have that I can answer. No question is a silly question, so don't be afraid to ask me whatever kind of comes to your mind when it comes to some of the support, some of the services, and some of the community initiatives I'm going to talk about today. Next slide, please. All right, so aging in place. And this is a really important slide that I always like throwing in there because we hear this term so often. I mean, what does aging in place mean? Well, aging in place means having the social supports and services you need to be able to remain safely in your home or wherever you call home for as long as possible. So there's really quite a bit of housing options that we have available for us as we age. Of course, aging at home is the most popular. We also have living with family. There's retirement and independent living communities, assisted living, and long-term care nursing homes. So Home Instead services all of these areas. We go wherever somebody calls home. Next slide, please. I also like to throw this care model in here because we're talking about aging at home and home care supports. And it's really important that people know that home care can fit anywhere along the care continuum when it comes to somebody needing services, whether they're starting, needing services once a week to support them and keep them safe and independent, all the way to 24/7 care if somebody needs. Home care can be very adaptable and can really assist somebody anywhere along this care continuum. Next slide, please. I also want to talk about building trust, taking the lead, and sharing your hearts, because this is the guiding principles of Home Instead. And I'm going to touch a little bit later on some education slides on how we build trust in our communities with a lot of the resources and public education programs we offer. We're always taking the lead, being innovative, whether it's our web-based training programs we offer or the home care tablet. And we're always sharing our heart and encouraging, our home care heroes to bring their personality into the field and service, as well as remain professional and really be innovative in our community. Next slide, please. So our mission at Home Instead is to enhance the lives of aging adults and their families. And we actually service anybody 18 years and older to help them age in place. So we are a family-funded home care agency. We are also LHIN providers. We service through veterans, and we're attendant care providers and WSIB providers. So really, if somebody has a car accident and needs home care supports as they're trying to get rehabilitation, we're a part of that team. As well, if somebody's injured at work, we help WSIB as they're trying to recover, as well as home care supports through the LHIN, which is government funded care, and as well as family funded care, where families purchase services to take care of their loved ones. Next slide, please. So before I tell you, these are all the services that we offer, which I know is going to be a question that somebody's going to have later on down the road, I'd really like to talk about how we provide care, because it's really important that you understand where we're coming from when it comes to our service delivery. So we really focus and center in on person-centered care and relationship-based care approaches. Every one of our clients has an individualized care plan that's tailored to their needs. And after they've received services and as they're continuing to receive services, we're always updating and providing quality assurance calls and surveys to the clients and families to see where we can improve upon in our service and to ensure that as they're transitioning with whatever they need home and support with, that our home care is growing with them as well. We have a specific focus on Alzheimer's and other dementias, which really touches my heart. And it was great to attend another presentation on that today. And I'm going to share some resources on that a little bit later on as well, when it comes to how we offer supports for Alzheimer's and other dementias. But right now, also thanks to the Village Project, we're training our staff on an amazing Alzheimer's and other dementia training program so they can provide better person-centered care and respond to dementia-related behaviors in a really great, positive, effective way to enhance lives. And then care for that family caregiver, which is where my heart goes out to. We know there's a lot of family caregivers that need support, whether it be respite services, extra resources at their fingertips, education. We have an array of resources available to them, and I'll touch on that a little bit later as well. Next slide, please. So here's our services. I decided to kind of throw them out on a slide here and break them down into different parts to hopefully help be a little bit of a visual. We of course have, our companionship and home helper services, which isn't always as popular as the personal care services, but we do see a lot of families have both, where they have that meal preparation and that transportation and homemaking, in addition to needing that personal care with showering, bathing, and grooming. We also have that focus on Alzheimer's and other dementia, as we do provide a lot of respite services. And we also assist with transitional care services and hospital discharge. We do 24/7 care if necessary, as well as palliative care and hospice support. And I also included attendant care veteran provider under the additional support care as well, because I always like to stress home instead services anyone 18 years and older. Next slide, please. Home care tablet. So I did a presentation on this actually earlier in this seniors event. We have a home care tablet that we're rolling out. That is a really great feature that adds to the home care services that we're offering as part of our integrated care plan. If you have any questions about that, make sure you check out the recording under the digital health panel. I talk all about the home care tablet. Next slide, please. Community resources. So this is another part that I really like to talk about as additional resources that anybody can access, whether they're utilizing our services or not. Next slide, please. So here is caregiverstress.com. I encourage you to write that down in your notebook if you have it in front of you. This is an array of resources for that family caregiver as they're caring for an aging loved one. There's a lot of questions around, let's talk about driving and, should my mom or dad give up the keys, or I've noticed some real dents in the car. I've noticed their driving habits are changing, all the way from medication management. So there's a whole array of resources on there, as well as expert blogs, videos that are both educational. And for any healthcare professionals on there, there's even a section for professionals that you can check out and register for some information too. So check out caregiverstress.com if you're a family caregiver needing support. Next slide, please. And helpforalzheimerfamilies.ca, write that one down. This has a grant. If you have a loved one with a diagnosis of dementia, you can actually apply for some potential free respite services, as well as an app that you can download on your phone to get some support. Next slide, please. Just keeping an eye on the time. This is the grant options. There's two different types of grants that anybody's able to access if they have that diagnosis. I encourage you to check out helpforalzheimerfamilies.ca or .com and click on the relief grant option. Next slide, please. And here's the daily companion app that's on that website. It also gives you some information on how to download it. It's free to have, and it's just a daily companion app to support you as a family caregiver who might have a loved one with a dementia diagnosis. Next slide, please. And readytocare.com is where we have our Pen Pals program. We have kindness ideas. If you really want to be kind and support an older adult in your community, you can actually check this out, see what's going on. Our Pen Pals program is really great. It's kind of linking up with our Be a Santa to a Senior program that we've launched this year. So check it out if you're looking to give back to a local senior. Next slide, please. And then our Home Instead Foundation, which is where we get, donations and different fundraising campaigns to support organizations that are nonprofit organizations that service older adults in our community. We had the hospice, Nipissing Hospice on there for our last Give 65 program, and we raised some really great funds for that organization. Next slide, please. And I also like to throw this in. We have a TV show on Eastlink where we discuss issues affecting older adults in our community. I am one of the 4 co-hosts for this TV show. I encourage you to check it out if you have access to Eastlink. We also post all our videos on YouTube, on Instagram, on Facebook, on all our social media. We're always looking for guests and topic ideas. Next slide, please. And that concludes my presentation. I'm trying to keep an eye on the time. I don't want to take any more time. I started at 7:07 and it's 1:17. So here's all of our phone numbers. If you ever want to reach out, we service all the way from North Bay to Sault Ste. Marie, as well as Barrie, Aurelia, and Midland. Put my email on there if you want to email connect with me, and both websites. So I'll open it up. If there's any questions, thank you so much for everybody that was able to listen to that presentation. And I'll just pause to see if anybody wants to raise their hand or if they want to type anything in the chat box. Check out who's online with me today. Got a quiet group. I'll also put my email in the chat box as well in case anybody wants to reach out to me privately. You definitely can as well, because not everybody's comfortable asking some questions over a platform that's recorded as well. So I can respect that. All right. Well, that concludes my presentation. And now the really exciting part is I get to invite somebody else to join and do a presentation. So our second panelist, I should say, is actually Robie Dickless, and she is a registered nurse in the geriatric, thanks for putting that in, registered nurse in the geriatric emergency management department at the hospital, so the GEM nurse department at the North Bay Regional Health Center. So I'm going to pass this over to you, Robie, to do, I know you're going to have a great, fantastic presentation and a lot of education for us. So I would like you to introduce yourself a little bit more, maybe include how long you've been in your role within the hospital, and if you could throw an interesting fact about yourself in there as well before you take it away and provide that presentation.
Thank you. I'm Robie Dickless. I'm an RN in the emergency room in North Bay Regional Health Center. I've been working in this field for around 6 or 7 years, but in nursing in general for over 30. Various places, various career choices that I've made throughout, but mostly in the critical care in the last 15 years or so. So part of where I got into this was I was an emergency room nurse, and they used to provide social work support in the department. Then that switched to GEM. So GEM's been going on for about the last 6 years. It was, so program development was with my coworker, Erin Soanes. She's the one that developed it here. Oh, sorry, just to back up a little bit. About myself, I'm grandma, grandma first now. That's my most important job in the world, I think. And love working with older adults as I've done this in the last 6 or 7 years. So, and looking forward to retirement. And I love animals. That's a good way of describing myself anyways. So to get back to GEM, so GEM stands for Geriatric Emergency Management. It started around, the pilot was in Sunnybrook Health Sciences, piloted in 1995, and then basically was spread out through various hospitals. Not everybody has GEM support in their emergency rooms. But if they do, then it's definitely enriched, focusing on care for older adults in the emergency room when they come in, which I think was, I can definitely say, sadly, overlooked a lot of the different syndromes that would be also involved around with older adults in an emergency room visit, which kind of would get missed solely for what they were there for. So it's definitely focused. We say 75 and over because that's the highest population generally that would need us, but certainly not, it's not age preference. There's more and more, sadly, more and more dementias being found in and diagnosed in younger ages as well. So we, and also because we don't have social work in our department anymore, we also can help out with some of our population that just would need some supports and linkages in the community that we can maybe help out with. So focus is care of the elderly, identifying most at risk, early assessment and intervention of geriatric syndromes, prevention of decreased impact on hospital resources. So years ago, could possibly be a lot more social admissions. There used to be a lot of just, can't manage at home and, need a break kind of things. Well, unfortunately, in this climate, we certainly can't provide those rest periods for families now. So we, with GEM getting involved right off the bat, and hopefully we can support, and again, back to the mandate of aging at home safely. And so that's what we basically are able to help. So we're frontline geriatric champions, educators, capacity builders. We do a targeted geriatric assessment here. That's kind of the longest assessment that you'll have from us. Sometimes it's just coordination and some discharge planning. So there's a broad spectrum of what we'll do when we're asked to see somebody in support of getting them home safely and linking them with services versus being an advocate for admission, when sometimes there needs to be a little bit more investigating into what's happening at home and what they can and can't do at this moment to support at admission if the physician is kind of sitting on the fence. If they're going home, then we're linking with the Northeast LHIN. We have a care coordinator here in the department that we work very closely with to make sure they have enough supports at home. Unfortunately, again, right now with PSW wait times, physio wait times, it can be very, very challenging getting somebody home safely. So we just pull out all the stops. We, anything we can add to that, right to a list of hiring out private to, just everything that we pull out of our toolbox. So when we do the geriatric assessment, it is a little bit longer, takes a little bit longer, but we do very similar to what a geriatric clinic would do or seniors mental health would do when they do. Unknown caller. Sorry, that's my phone. Where they just do a deep dive into, their past, get a personhood, which lets us know everything about that patient for when they were, what they did when they were younger, their family connections, right to how much water they drink and how much they sleep. We do medication reconciliation. Work closely with pharmacy here in the department. And that will give us a really good idea. And then if they do, whether they're admitted or not, it allows us to maintain if they come back into the emergency room, because a lot of these people do need the emergency room more often than not, with either no family physician or difficulty getting in to see a physician. So they do represent, and then we have a really good basis of information on them before they for when they represent. So we started in March of 2015, and we've actually, we have a new project on the go as well, which is called Geriatric Community Outreach Paramedic Program, GCOP we call ourselves. We don't have a badge, but we'd like one. It's one of myself or Aaron, and hopefully soon another full-time RN do community outreach program. So we go with a paramedic, and we are receiving referrals from family doctors to our own case finding here, to our identifying seniors at risk calls that we make to follow up emergency room visits, to home and community care, which started this program with a body of funding last December, or at least asked us to create a program. Far as I know, there's nothing else like it in all of Ontario, so we are definitely a pilot. And it is going so extremely well. The problem has been, because there's just myself and Aaron doing it right now, one of our other part-timers went to seniors mental health, so we haven't been able to do full-time. So our funding is till the end of April right now. We are hoping to have a full-time person sooner than later, and that will give us the Monday to Friday till the end of April, and hopefully after that they will give us permanent funding, because they've been really piecemealing us together with some funding to keep going. So what that involves is basically the same idea of what we're doing here, but we add a lot more assessment component. We have a physician that we work underneath. We use medical directives that go into the home, so we can start IVs, give fluid bolus, do blood work, urine. We do the assessment, we do the med reconciliation. We are linking with whether they need BSO, seniors mental health, really any access to any other of our services out there. So, and primarily it still rolls back most to the Northeast LHIN with increased services and their professional services. And that's how it started. It started with the body of funding back in December. We created this, and then with working with community paramedic program, which is in and of itself expanding, which is getting a lot more professionals into the home to assess some of these people that are in our catchment. So it's been fabulous. We love it. That's what Erin's doing today. So she would have had slides. I'll tell you that. I'm not that good at this kind of stuff. So she would have definitely had slides. So between the two, and I failed to mention the ISAR calls, which we make, identifying seniors at risk, which is part of our geriatric emergency management, is a follow-up call, 75 and over, to somebody who's been to the emergency room. Same idea, targeted set of questions that we can do, ask them, and then just see if we can support them. We tend to not hang on to either the GCOP people or our emergency people, just kind of on a background. It's if we've seen them, we've talked to them, we've got notes on them, we quite often give them our telephone number to call us, and we can follow up when we need, but it is kind of more on a day-to-day. And some of the GCOP people we have maintained in our portfolio, but majority of it is kind of like kind of swoop in, save the day, and move on to somebody else. So that's kind of how we're set up, same as in Emerge as well. But I can tell you it's all of it, all the way around, whether it's in the community and in the emergency room. We're, not to ring our bell too much, but we're very productive and very, we have a lot of impact in helping seniors stay safe at home. And I think that's about it. I don't know, I've probably missed a whole pile, but I think that's it for now. Any questions?
That was fantastic. A lot of information. I have a couple questions that I'm going to pause on because we have 2 questions in the chat. Sure. So I'll just read them out, and we'll start with the first one. This is from Samantha. So question 1, if someone is accessing a hospital outside of North Bay, and if we aren't sure if that hospital has this program, would a GEM nurse automatically be assigned to an older adult who comes in, or is this something a family member can request?
Absolutely. If there's GEM and emerge, so the first thing that they would do if they're going through an emergency room, because GEM is in the emergency room. So that's where you'd find one. All hospitals have different, they could have 4, they could have 1 or none. So if they found themselves in emerge for whatever reason, and they could ask somebody, do you have a geriatric program? Do you have a GEM program here in your emergency room? And if they say yes, then say, can we have access to them or could we see them? I don't know how it would work with somebody from out of town, say meeting a specialist. I'm just kind of thinking if that was somebody here coming to our emergency room to see, say from New Liskeard coming down to see an orthopod or something like that, could we talk to them? I can't see us saying no, but it all basically goes around workload. You don't automatically get assigned. We have access to our tracker, which has 75 and over, and also the emerge tracker, which lets us know if there's anybody else in the department that we may see that doesn't fall in the 75 or over. We keep an eye on it. And we can case find based on, frailty scale, based on that kind of thing, but we don't necessarily just automatically see all the 75 and over. That would be perfect in a perfect world, but sometimes we have 13 or 15 in the department. So it based on our criteria of, what they're here for, if we, in case finding, if they have some, identifiable things that we could just dive right in and help out. But otherwise it's sometimes in collaboration with admission versus home, can we get them home safely, and that kind of thing that will get asked by the physicians or the nurses, say, oh, we have somebody for you. So in another facility, it would really depend on if they're there, if they had capacity to come, and it would depend what they were looking for. If it's just information on how to access services in your community, which is, that 1-333 number or whatever, that's like for the LIN that anybody could access all over Ontario to get your home and community care in your community. That would be a great way to help them out. But it would be very specific to the emergency room. Okay. Sorry, I hope that answered the question.
It was a very good question, a very detailed question, and that was a very detailed answer. So hopefully, and Samantha, if you do have a follow-up question, feel free to, of course, put that in the chat. But we do have another question for you. For the outreach nursing, is it possible for family members to refer for these kinds of check-ins, or is a medical referral required?
A medical referral it's like the referral can come from just about everywhere, and that's where we're kind of getting it. So far it is related to health care, like, so whether it's the community paramedic, we had 2 yesterday that were from community paramedics that are going in thinking they need, or requesting that GEM go to do a more detailed assessment. Coming from family physicians, the Northeast Lynn Care coordinators, if they're struggling with getting some services in place, or for whatever reason just need us to go if they're being limited in any case. And myself have grabbed some great ones just talking to family members of people that have been in emerge. So I'm arranging it that way. Our nurses, our co-workers, our social workers upstairs with difficult discharges are referring to us. So no, I think right now there wouldn't be, unless somebody's like, oh, I had somebody come and they kind of tracked down, it came from emerge, called and said, is there any way that you could come and see us in our house? Haven't got there yet, not to say that might not happen. But right now it would be through, if you have home and community care, and said like, is there any way that they could come and see me at my home, then we could arrange to do it that way. But I don't know of a way like offhand where it would just be somebody calling and saying, can you come, unless they've either seen us here, met us, or through word of mouth, or they have home and community care and that's offered to them as an option.
Awesome. Great questions. Thank you for answering both of those. I just typed one other question in the chat. And if anybody else has any other questions for Robie, this is the time to raise your hand or put that comment or question in the chat. My question's more around this pilot program that's really exciting that I heard you announce. Now, can you direct us to any maybe information on that pilot program? Because coming from a perspective of an organization, I'd really like to learn more about the program and also support the pilot, as I know your end game is to secure funding long term.
Yeah. So they're like right now, we're just struggling with trying to come up with how this is going to look, because the money is coming from the ministry now. We're kind of struggling through with metrics and data collection and how we're going to, because this is just, it was almost kind of thrown on our lap and we created this. How this was going to look, and we've been just moving along as we go. There wouldn't be anything official right now anywhere except for us just calling us and saying like, where we started. And it was really just what we do in the emergency room and taking it out to the community and adding the piece of being able to do blood work, like, getting trained to do phlebotomy and doing what we would do if somebody came in that was dehydrated with our medical directives, working with our person here in the emergency room to allow us to work safely under a medical directive. It's all under the emergency room right now at North Bay Regional. So you wouldn't be able to, I don't think there'd be anything else anywhere else that would say that we're officially doing this outside of us right now. We'd love it if it ever did blow up, because that would be an amazing thing. But I think because community paramedic is kind of going in that direction, they can now collect a urine. I think maybe that's what they're going to do eventually. And if we ever got a geriatric clinic, would we need to do GEM visits in the home? I don't know. This could be, until we expand and have a geriatric clinic. I think that's something we'd love to see happen. But for now, and because it's so piecemeal and everything's so part-time and we don't know when it's going to end, other than now, the ministry is just asking for a bit more of the data collection and how we're just kind of struggling with that. As GEM nurses, we just want to go out and see our patients. We don't want to do all the other stuff. So a little bit of pushback there, but other than that, we're unfortunately, I wouldn't be able to give you much more than just our program development. And like we don't even have a mission statement yet.
Okay. I can understand that from the healthcare perspective. You want to go heal, right?
Yes,
data entry.
yes.
Who wants to do data entry?
I want to get stuck with workload. Exactly.
Fortunately, you need that piece when you're securing funding.
No,
it'd be really great to continue on that conversation. And I'm sure you have some linkage with the local Ontario Health team, but there might be some good collaboration there between the pilot and
that's what we're hoping.
Yeah. No, fantastic presentation. We appreciate that. I know you're working hard. We're right in the hospital. We appreciate you being able to show, some really great information on this program, provide any more insight. We've definitely appreciated everything that you've said, and I'm sure we'll be connecting again with you afterwards. So thank you so much.
You're welcome.
Great. All right. So we're going to continue to move on with our third panelist, and I'm excited to invite on. So hopefully, I think I saw her online earlier. We have Lori, and correct me if I pronounce your last name wrong. Cappadocia? Lori Cappadocia? Pardon?
That's correct. You got it.
Oh, wow. First time for everything. So you are a community service coordinator for seniors transportation with the organization Canadian Red Cross in North Bay. So very excited to have you on here. I know there's a lot of questions surrounding transportation for older adults. So thank you so much for joining us today and providing some information. Same thing over to you. I'd like you to introduce yourself a little bit more, maybe including information about how long you've been with the organization. And if you want to throw in an interesting fact about yourself, feel free to do so. So take it away, Lori.
Thanks so much, Nikki. So again, my name is Lori Cappadocia, and I've been with the Red Cross here in North Bay for 12 years, actually since we received funding for the Seniors Transportation Program. I absolutely love my job and the community that I work within. Quick fact about me, I'm also an animal lover and I am still working from home. I have two dogs as coworkers presently, and they're not as congenial with being polite during Zoom presentations. So if they happen to interrupt us at all, I apologize in advance. But yes, so in terms of the services that we provide for older adults here in the Nipissing community, the seniors transportation is available to those who are 60 years or better, residing anywhere within Nipissing. So that can be anywhere from, North Bay in the city proper to Mattawa and Verner and pretty much everywhere in between. We've been supporting our clients to get to their medical appointments throughout the COVID-19 pandemic, and I said since 2009. So in order to qualify for our service, you do still need to be living independently. That can be with family or extended family, but not within a long-term care facility. You also need to be mobile and independent enough to self-transfer into a passenger vehicle. We do use our Red Cross program vehicles to pick up our clients, and the volunteers can provide an arm or a hand to help support clients when they're getting in and out of the vehicle. But clients do need to be able to board and deboard the vehicle primarily independently. Now, in terms of clients using mobility devices, of course, they're more than welcome to bring a cane or a walker if they have them. Our volunteer drivers will take those devices once the clients are safely boarded the vehicle and store them in the rear of the vehicle. And ensure that once clients get to their appointments, that they get those items out of the back and have them ready and waiting for clients as they deboard. Now, we are a door-to-door program, not a curb-to-curb. We ensure that our clients get safely into their appointments. We don't stay during the appointment, but we leave our clients with a name and a contact number for their driver once they are dropped off. And then once the client is done, they would call the driver would come back and get them and bring them home. Now, in terms of our hours of operation, we're quite flexible. Primarily, we're during business hours, and our office is open Monday to Friday, 8:30 a.m. to 4:30 p.m. But driving services can happen outside of those hours. Of course, we have a lot of medical appointments that may happen before 8:30, especially if they're outside of the city. So we always encourage clients to still call, even if their appointment is a little bit earlier, a little bit later, or even on a weekend. We quite often have clients who go for dialysis on Saturdays, or they may be going for different tests at the hospital on a Saturday or a Sunday. So still call and request those services. It's not a barrier. Typically, we have plenty of volunteers available in evenings on weekends as well. Now, in terms of our volunteer drivers, we have a fantastic group of trained volunteers here in North Bay. We onboard them, ensure that they are fully prepared for their roles, screen them, and they provide services to our clients. So we don't have any paid drivers. They're all volunteers. They use our Red Cross vehicles, as mentioned earlier, to provide these services. And right now we are primarily focusing on medical appointments. There's quite a lot of backlog right now of medical appointments that were delayed over the last year and a half. So we're focusing on getting those. We hope to eventually be up and running fully again and provide transportation services to social outings and non-medical ventures like groceries and friendly visiting. But for at this time, we're primarily focusing on medical and access to essential services like Seniors Day programs and things of like nature. Now, in terms of the cost associated with the program, it is partially covered by the Red Cross, and there is a low cost client fee for clients. An example for local trips in the city of North Bay, it's $13.60 round trip. It's all done through invoicing, so the clients do not need to have any money with them when they're utilizing transportation services. The Red Cross will keep a record of how many rides the clients use in a month period, and then we would send them an invoice the following month. But yeah, I think that's primarily what my program services in a nutshell. Here in North Bay, the Red Cross, of course, offers emergency management services as well. And we do have our PATH program, which is an acronym, Priority Assistance to Transition Home. And it is run out of the North Bay Regional Health Center, as well as there are satellite offices in the Sturgeon Falls Hospital and the Mattawa Hospital. And they utilize our volunteer drivers with the Seniors Transportation Program to help provide assistance to clients who are being discharged from the hospital to get home safely if they went in, say, by ambulance, or they had somebody bring them in, but they don't have a safe way home. We get them home and we provide some supports to get them settled and well off. And we can also provide some temporary transportation following the discharge to any medical follow-up appointments they may have. But yeah, I think that's everything. If there are any questions, I'd be happy to answer them. I can also put my email address in the chat box if anyone would prefer to send questions by email. And I'm just having a look to see if that went.
We've got a quick poll about transportation access. I'd love to ask the attendees, what kind of transportation do you have access to currently? So I'll go ahead and launch that poll just quickly. All right, we're at 85%, and I'll end the poll in the next 10 seconds, and I'll share with you, Nikki.
All right, so if we look at the poll results, we have 67% saying I have my own transportation, with 17% saying my family friends provide me with transportation, and 17% saying I access public and or private paid transportation, and 0% saying I do not have access to transportation. So that's the poll results. Thank you for providing that poll. It's always great to get kind of a background information. I know transportation is a big topic, and access to transportation is a big topic amongst many communities. And I'd have to say, the $13 subsidized rate is a very affordable rate for people to be able to access transportation. So I'm really excited to hear that piece from your presentation, Lori. I'm typing some questions in here. Now, Lori, you direct messaged me your contact information. Can I share that in the chat with everyone?
Yes.
Okay, perfect. I wanted your permission first. It's weird.
Reset it. I had put it to all panelists and attendees, but Zoom.
That went to me. I felt special that you sent it to me. I was like, oh, this is awesome. So I want to make sure it's shared with everyone because it's really important that they know they can reach out to you. So we'll start with my questions. I'm just going to see if there's any in the Q&A. Got a quiet group today, but that's okay. I'm just curious about your referral process for somebody. Do they just self-refer by calling? Is there a particular referral form? If you could touch on that.
Of course. So we have many different methods for referral. The most popular one is self-referral. A client would just call us at the North Bay branch line, and they could let us know that they have barriers to transportation and that they'd like to be assessed for services. We also receive frequent referrals through CareDove, which is open to the public now. So anyone could go to caredove.ca and self-refer if they prefer to do it online. And of course, the LIN, the hospital, doctor's offices will refer directly to us as well. So really, it's any method you'd like. The door is open and you're welcome to contact us independently or have a family member or friend contact as well.
Oh, that's really good to know because some people might think there's limitations, right? What's the wait list like? Is there a wait list or does it just depend on, I guess, what your need is for transportation?
Right now, we're trying to operate with a very limited wait list because all of the services that we're providing are essential medical transportation. It's actually, there's not really a wait list. There's a registration list, but typically if somebody comes to us and says, on December 16th, I need to get to Sudbury to see my cardiologist for such and such appointment. We would take that date into mind and we would try to get them assessed prior to that appointment and ensure that they get there. So
no, it's good. That's great. There's that flexibility. I'll keep going since like I have a lot of questions. Sorry, it's great to know about this service. You mentioned volunteers are the ones that providing the transportation. So is it beneficial? Are you looking for more volunteers to train? Do you have the capacity to do so?
Yes, we are always recruiting and onboarding volunteers. We always have clients coming onto service. So we're always as well recruiting volunteers to help support those clients. Anyone who's interested in volunteering, go to redcross.ca. Our application process for volunteers is found online now. So it's really quick and easy. You go there, there's job listings, you would put in which one that you're interested in, and they would send you to me.
Oh, that's great. Oh, okay, great. I'm just going to pause in case anybody else I don't see any hands raised, just in case there's any other questions, but there's Lori's information. Feel free to reach out if you have any further questions. If you want to chat about volunteering, chat about getting some transportation services, or maybe even chat about the PATH program. I know that's a fantastic program as well. So I'm glad that you mentioned that in your presentation. Thank you so much.
Thanks.
Great. So we are moving along here. We still have, it's 10 to 2. So we still have a good 40 minutes. And I'm going to pass this over to Leslie Price. Do we have Leslie on here with us today?
Sorry, Nikki, I don't think I see Leslie
No,
I didn't hear a response from my reminder.
Okay, that's okay. I can definitely, I'll pause and I'll take a look again towards the end in case she does join. So I am going to pass this over to Darlene because I see that Darlene's on here. So welcome our fourth panelist, Darlene Tripp. And she, I guess to have a link here to your bio, which can be found on myhealthunit.ca. And your business is called Hello Darlene. So I'm actually very excited to hear about your home care organization. And so the same thing for yourself. I'd like you to introduce yourself, explain how long you've been working with Hello Darlene, which I'm going to guess is since the start of the business. And I'd also, if you want to throw in an interesting fact about yourself, that would be really great. And I'll take it away and you have the floor.
Thanks so much, Nikki. And hello to everybody. My name is Darlene. And let me see. So I retired in 2019 after 34 years in the finance industry. And of course, in the middle of the pandemic, somehow organically decided to become an entrepreneur. It really stemmed from my husband and I being a caregiver for his mom, who is living a dementia journey, and also helping my own mom with aging at home. So being in the financial industry, of course, I've had many years of experience in helping powers of attorney and executors when those needs have arisen. And so I just identified a gap in the community that I felt I could help fill. So I'm a mom of 2 girls, a very recent empty nester as well at the same time. So creating a new business at this time was perfect for me. And I also have many pets. I have 2 dogs. I have a bunny actually as well, and lots of fish. So we love animals at the Tripp House as well. So what does Hello Darlene do, and how do we help our community? So we have only been in operation 1 year. We launched in November of 2020, and it's been such an exciting journey so far. And I can really attest to some of the presenters already, the Red Cross in particular, because we've had some personal interaction with them, with our family, and they are fabulous. So Hello Darlene is a professional organizing and senior transition business. So basically we can help you organize everything and anything when it comes to transitions, aging at home, downsizing, and relocation. But in particular as well, one of our unique services is helping caregivers and families navigate the sometimes complex process of documents and the healthcare system. So we have a service called Legacy Planning Organization, and we sit down with family members, powers of attorney, and potential executors, and we help create a plan where all of that information would be very easily accessible to them at any time. Again, we're a professional organizing business, so we do assist with downsizing and decluttering processes if you're looking at relocating, or decluttering if you're planning on staying at home, because decluttering is an important part of that process to make sure that your environment is safe. We do provide companionship as well. without any medical requirements for anyone who is looking for that service as well. So we can basically organize everything and anything on your aging journey, and we work with you and your family members to make the transition smooth and to provide a less stressful environment. Like I say, we have only been in operation for 1 year, and we have collaborated with a lot of local businesses already. So we're really thrilled that we have been able to connect with the village and all of the panelists here today. And I think, I mean, we do also help, just so that you know, we also do help as a professional organizing business, everybody and anybody who may need help within their home. It's not just older adults that we help with those pieces of our business, but our primary focus is helping older adults in our community and their families. And I'm going to pop my email address and website here in the chat as well.
Yes, I was going to say, if you can share your information, and I believe I just got an email notification that you're also providing a presentation a little bit later today on your home care company as well. Is that correct?
Yeah, so the presentation will be getting ahead of the downsize, as well as everything to plan to age at home. Non-medical needs, of course. And so I'm looking forward to everyone and anyone that can participate later today.
No, that's fantastic. It's always great to hear about different home care options in our communities. We know that that's such a need. I'm just monitoring the chat to see if there's any questions. Don't see any, so I have some questions that I can ask for sure. I mean, what is the best way for somebody to access your services and get referred? Is it phone, email, website? Is there a preferred method?
No, really, they can reach out to me any one of those ways. And, you know, most times clients reach me via email, but whatever way is preferable to them. My services are also available virtually. So I do help clients also all across Ontario with legacy planning because it's a virtual service that I offer. It also is convenient if, you know, family members are located in different areas within Ontario or beyond, then everyone can be part of that call with regards to the planning presentation and organizing for what next steps might be if they're looking at relocating to a retirement living community and they're looking for, you know, connections and support through that process as well. And I do have business cards, rec cards, and a website, as I said, and I will share that as well. I'm on Instagram and Facebook, and you can follow along on any of those social media platforms. I'm also on LinkedIn for anyone who is on LinkedIn. And yeah, we've had a lot of fun so far, actually, on social media, and have been pleasantly surprised at the kind of interaction that we've had from all age demographics. So thank you to whoever is mentioning that they've seen me on social media. I love that. And I'm glad that you're able to follow along.
I'm going to have to follow you myself on social media. See what it's all about. No, that's great. I mean, social media has a lot of advantages to reach a lot of people in our community. So it's great that you're able to share some of your resources and services on there. I also want to note prior to that comment, there's Robie from the hospital. She's wondering if you can drop off some of your business cards so the emergency department gem nurse station can have them and potentially hand them out to patients as well as they're looking to refer. And then, yes, that comment was, thank you, Darlene. I just want to say that I love the engagement and the way that you communicate on social media. Your Instagram is awesome. 100%. Yeah.
I think I just want to add that, you know, for me in particular, I come to my business with the personal experience of being not only that sandwich generation person, but also a caregiver. And, you know, being that individual who's in the community looking for resources. And so I just love what the village is doing. And I love that lately there has been so much more of the conversation that has been started about all things aging. I think it's so important. And so I love when we're able to do collaborations like this, because the more that we can go to the community, the more that caregivers in particular will know what's out there and be able to help them. Because as a caregiver myself, I know exactly what it's like to walk through that journey, and it can sometimes be difficult. So that's a huge part of what we do at Hello Darlene as well, is as organizational experts, we really help families break down what some of those responsibilities are, if they're a power of attorney or an executor. And then we also have some great collaborations within the community, whether it's financial planners or lawyers or accountants, if they're in need of other services as well. So it's definitely a document based service for the legacy planning, but it is unique, and it's been very well received.
No, it's been fantastic. I don't see any other questions in the chat box right now. I don't think I have any other further questions. I believe that there might be, so thank you so much for sharing that information. If I can sneak in, I'm going to try to watch your presentation a little bit later as well, where you can dive in. Yeah, to more of your services, have more of a discussion. So if anybody is watching and they want to learn more about Hello Darlene, check it out. Check out the website. It's at 3 o'clock, the link there, and you definitely can follow up. So thank you so much for joining us today and sharing that information. Great. I don't know, Kelsey, if you have another poll, because it's only 2 o'clock. So I'm not sure if we've had a panel. Go ahead.
I do. I have one more poll. It's just on living situations. So the question is, what best describes your living situation? And you can pick all that apply. So I'll launch that right now. Okay, we're at 66%. Get 10 more seconds. Okay, I'm going to end the poll now and I'll show the results.
All right, so the living situation poll. So 25% have stated I live alone, where 75% stated I live with other family members. And then all of the other options were 0%. And then there's choice 7, which I like. That's the one I would have picked, just a kid. So no, that's really.
That's interesting, Nikki. I just want to say something really quickly about that. That's the data that we see for the region, that it's about 30% of people live alone. And yeah, so that 25%, and then the rest, the other 70% live with other family members. And out of all of our older adults, about 85%, 90% live outside of assisted living or long-term care homes. So most people live without assisted living or long-term care out of the total number of seniors. So just to give a little perspective.
No, I appreciate that, Michelin, that you had brought that up. And these polls are actually very helpful to get some real data about who's kind of watching today, and where individuals are coming from and what they're looking for in terms of gathering information and support. I want to thank each of our panelists that joined us today and shared some really great information on some aging supports at home. We know, I've heard this question so often. Navigating our healthcare system is challenging. So it's really great to be a part of the Senior Symposium event. To be able to, get the information out there on a virtual platform, even if we run into tech issues or I join as somebody else or, something goes down. We've been doing really well. And it's really great to have everybody online learning and growing with us, because it takes a community. And I know the Village Project's been mentioned a couple times. Fantastic organizations and resources that are a part of that. And I'm excited to see where we're going to grow as a community. I'm excited to hear about new pilot projects that are happening, and how can we support each other to really make a difference and support our community as we do age. So thank you all so much for joining. It's still a little early, so I'm not sure if we want to open it up to a general discussion. I'm kind of throwing this at Michelin and Samantha to help me out a little bit.
Yeah, no, it's okay if we're done early. We just wanted to make sure that the presenters had more than enough time to share and that the attendees had all their questions answered. And if we've done all that, then there's no reason to hold people up.
No, that's perfect. Wow. Well, thank you all so much for attending today. We've appreciated everyone. All the panelists were fantastic. If there's any final thoughts, I will pause if anybody has anything that they'd like to add. Otherwise, we will be ending the meeting. And we hope to see you at a lot of other really great sessions that are coming up in the next couple days.
I just want to say thanks so much for doing this. This was great. I wasn't sure what to expect. Like I said, it's not usually my comfort zone to do stuff like this, but great just, to be able to network to what's out there. It's awesome.
Yes, thank you for the opportunity to join.
Great.
Yeah, it's been great meeting everybody today, and I look forward to connecting with everybody again after today as well.
This is fantastic. Well, thank you all so much. It's great to exactly network with everyone. So thank you all so much. Hope to see you at other sessions. Stay safe, everyone.
Bye now.